Hello everybody, I'm Trisha Vasan, working for Tipton Training in Sales and Marketing. I'm here with Paul to talk about his very successful one-year practical restorative course. So Paul, can you tell me more about this course?
Sure, Trisha. Course is 1 day a month for 10 months, so we have 10 different days. It's based purely on practical restorative techniques. So we encourage and we show dentists how to use the correct techniques to do tooth preparation, to do amalgams, composites, gold onlay preparations, 3/4 crowns, etc.
And Paul, can you tell me who should attend this course?
It's an ideal course for, first of all, the people who've already done the restorative course, the theory course. It's an ideal follow-on. But also it's a standalone course that can be undertaken by dentists who just want to improve their practical skills. The course is very practical in nature, and it's there for the young dentists who've just qualified. I know that some of the dentists qualifying these days maybe don't have quite as much experience as they would like at tooth preparation techniques, bridge preparations, posterior composites, etc. So it's for those young dentists who have recently qualified and maybe don't quite have the experience of these techniques. And it's also for the mature dentists who want to really improve their techniques from those that they were taught or those techniques that they're using today. There's lots and lots of changes in restorative dentistry over the years, and this course aims to teach the very, very cutting edge of all these practical tips and practical techniques.
Paul, can you tell me why should a dentist attend this course?
Well, as well as just improving their techniques, it's also in these very hard times an ideal opportunity to improve the different types of treatment that you can give to patients. We'll explain all the different possibilities from basic treatment techniques up to more advanced ones, which will allow dentists nowadays to go and earn more money and also increase their fees, turn more private, and give them the confidence to sell more to the patients that come into their practices.
Paul, can you also tell me what are the topics covered in the whole course?
Sure. The topics, we start off with tooth preparation and anterior and posterior bonded crowns. We find that this is an ideal time to get the dentist to sit properly, so posture is very important. I'm a big believer that they should be sitting at 12 o'clock behind the patient, not at 11 o'clock, 10 o'clock or 9 o'clock. We teach two-handed tooth preparation techniques, so you have a lot more control over the drill and the burr and the turbine handpiece. We teach techniques that involve the speed increasing handpiece so that you can feel the actual preparations through your fingertips and you can finesse the preparations. We also teach a lot about laboratory techniques. A very important part of this course is that you understand and learn laboratory techniques as well. An important part is that when you do the preparations and we take impressions afterwards, we send these off to a technician, the technician makes the work, and then you bring back your restorations and we can critique them. We can actually look and see how good your technician is, or the technicians that you're currently using, and we can then critique their work and maybe see some ways that they can improve it. So the topics covered, we start off with the tooth preparation, and then we go on to discuss porcelain veneers and do practicals in porcelain veneers, partial porcelain veneers, gold work. Don't forget that gold, fantastic long-term success. Gold work nowadays, you should be looking at 90% plus success rate over a 45 to 50 year period. So we do teach some of the traditional gold work. I'm a firm believer in gold work for some of the more elderly of our patients perhaps. 3/4 crowns, gold onlays, 7/8 crowns, those sorts of more difficult preparations. Again, techniques which haven't been taught at university. We go by the book, we go by Schillingberg's techniques. So a great book to accompany the course is Schillingberg's Fundamentals of Fixed Prosthodontics and Fundamentals of Tooth Preparation. We move on to porcelain inlays. We talk about posterior composites, anterior composites. Again, we are very much into anatomical carving of composites and amalgams. So we like to teach tooth anatomy, especially for the posterior dentition. We go into bridge design and bridge preparations, including Marylands. and the use of additional preparation features for Maryland, such as grooves, boxes, retention form, etc. Overall, we cover everything that you would need to learn to understand into both tooth preparation and also restoration techniques.
Thank you so much, Paul. Can you also tell me what's the structure of the course?
Structure of the course, as we mentioned, it's 10 days. Each topic leads on from the other. So we start off with the basics, as we mentioned. We include laboratory techniques. Each day starts with a lecture by myself, and that's basically about an hour and a quarter or so on the topic of the day. There's usually about 3 to 4 exercises or tooth preparations or restorations that we'll be doing. And during that initial lecture, I'll be talking to you about how we're going to do it, why we're going to do it, and show you on a step-by-step fashion with slides, etc., exactly how that restoration is going to be completed.
Paul, can you tell me where's this course going to be held?
Yeah, we have venues up and down the country. Traditionally, obviously, I'm Manchester based, but over the years we've had an awful lot of people come from different areas of the country, and they've all been saying, why don't you bring the course down to us, Paul? Well, we do now, in fact. So we now do the venues. The courses are held in Manchester, also in Leeds, and down in London.
Okay, thank you very much, Paul.
Pleasure.
And
Look forward to seeing you.
yes, and all the details are on your screen. Please log on to our website www.tiptontraining.co.uk and book yourself on the course. Thank you very much.